Namaste, Vanakkam, Swagatam. Good morning, everybody from the Institute of Salutogenesis and Complementary Medicine of Sri Balaji Vidyapeeth, a deemed to be university in Puducherry, formerly called Pondicherry, India, one of India's top 100 universities, ranked with the A++ by the NAC. It gives me great pleasure today on this auspicious day to begin the first colloquium presentation by a research scholar from the ISCM of SBB. And it is our great honor that it will be none other than Dr. Rama Reddy Karri, a very distinguished psychiatrist, educationalist, humanist of India. Before we begin, I would like to invoke the energies of the divine grace through a prayer. Sahana Bhavatu, Sahano Bhunaktu, Sahaveryam Karvavahai, Tejasvinavadhitamastu, Ma Vidvishavahai. Om Shanti Shanti Shanti. Om Shri Gurubhyo Namaha. Hari Om. Welcome everyone to this colloquium presentation by the first Ph.D. scholar in yoga therapy at ISCM of SPV to do so. I would like to express our gratitude at the outset to our respected Chancellor, respected Vice Chancellor, Dean of Faculty, Dean of Research, Registrar, Vice President, Research and Innovation, all the faculty and staff members of SPV, our GM admin, and others who are constantly supporting each and every activity being done here at the ISCM of SBB. I would like to welcome to this colloquium our dear Professor Panch Ramalingam sir, who is one of the eminent personalities of Puducherry, India and the world. Sir is the President of the Indian School Psychology Association. He is doing amazing work at the Academic Staff College of Pondicherry University. We welcome you, sir, to this colloquium. We would like to welcome Professor Vijaya Gopal ji, who is a co-guide for this thesis and has given immense support to us throughout the process in all our RAC meetings. We welcome you, sir. We would like to welcome Professor Madanmohan, sir, who is also our external expert. He is the Bhishma Pitama of all the yoga therapy activities that have been there at JIPMER, have been here at Mahatma Gandhi and continuing to be there in so many forms all over the world. We welcome Professor Madanmohan sir to this colloquium. I would like to welcome each and every one who has joined in today for this colloquium. Today we are here to witness the first colloquium presentation of yoga therapy by Dr. Rama Reddy Karri, who is registered for the PhD in yoga therapy at SBV. And he will be presenting his work titled Efficacy of Different Yoga Techniques on Negative and Cognitive Symptoms of Schizophrenia, a Comparative Study. I am his guide. It is an honor to be his guide for this work. And Dr. Meena Ramanathan is his co-guide here at the School of Yoga Therapy for this work. This work has been recommended in the RAC at its 6th meet held on 11th November 2022 and The requisite approval was accorded by the Dean Research through Registrar SBB on the 7th of December 2022. With this information, I would like to introduce Dr. Rama Reddy Karri. Dr. Rama Reddy Karri, he has a world record for the most divergent educational degrees, most number of diverse educational degrees. He has already completed numerous PhDs in addition to his MD in Psychiatry from NIMHANS. And Dr. Rama Reddy is a B.C. Roy National Awardee. He has received the highest awards from the Indian Psychiatric Society, Indian Medical Association, Global Association of Physicians of Indian Origin, and he has worked as the Director Consultant of the Manasa Hospital in Rajamahendravaram. It is our privilege that Sir decided to do a yoga therapy PhD here through the ISCM. At that time, it was site of Sri Balaji Vidyapeeth. Without taking up any more time, I would like to invite my dear Professor Rama Reddy Karri to present his work on this occasion. Over to you, sir. Namaste.
Thank you, sir. Thank you very much for your kind guidance and introduction. I'll proceed, sir, by sharing my screen. Am I audible, sir? Right. Hope my screen is also visible.
Yes, sir.
Namaste, all of you. Thank you very much for attending this session. Efficacy of different yoga techniques on negative and cognitive symptoms of schizophrenia, a comparative study, Colloquium. First, I welcome you all. Asmat Gurubhyo Namaha. I pay my respects to my guide, Professor Ananda Balayogi Bhavanani ji, by offering him a digital bouquet. I offer my respects to Dr. Meena Ramanathan and Dr. M. Vijaya Gopal, my co-guides, for offering a digital bouquet to both of them. I pay my respects to Dr. Madanmohan ji and Dr. Panch Ramalingam ji by offering digital bouquets to them. They have supported me throughout all the RACs. The great university, Sri Balaji Vidyapeeth, although it is deemed to be a university, getting NAC A++ for a private university is such a great thing. And I am so fortunate to be part of this university. And I'm the first PhD candidate from ISCM. I am very fortunate. And I offer my gratitude to Chancellor Sir, Vice Chancellor Sir, Registrar Sir, Dean Academic, and Dean Research or Vice President by offering them. Your precious time you are spending here, and I'm so happy and I'm grateful to you all, the audience, for coming to this colloquium. The agenda of this particular presentation is one, of course, introduction of the problem. Data collection, sampling design, sample selection, interventions, assessment, pre-assessment and post-assessment of the intervention. Statistical design, tabulation, data analysis, and interpretation, discussion, implications and future directions. Development of a new tool, and questions and answers. The progress till today started with a research proposal. Because of COVID, we had to shift from school yoga research to schizophrenia research. Then the next step is getting the ethics committee clearance from G.S.L Medical College, where my co-guide is working. CTRI registration was done. And part 1 theory examination, I was given exemption from appearing a research methodology as I already had PhDs, and I completed the course and part 1 subject examination. And I presented in 7 journal clubs, and I attended all the journal club presentations presented in the department. And I have 2 publications. One is already published, one is under publication, accepted. Then I undertake teaching and seminars, both in the department and also outside the department in psychiatry field and many other fields. Data collection, analysis, and 6 RACs were over, leading to this colloquium. The introduction of the problem. You are all people who are well versed with the problem schizophrenia, but a few minutes saying something about the schizophrenia and why the problem is chosen. You know about schizophrenia, it's a very prevalent 1% population they suffer from schizophrenia, and it leads to a lot of problems both for the patient and for the family and also the community. It has hereditary factors, biochemical factors, and also stress factors also may influence this one. It has got positive symptoms and negative symptoms. Positive symptoms are in the form of hallucinations, delusions, and aggressive behavior and so on. Whereas negative symptoms, especially in the chronic state, lack of motivation, lack of drive. So these are called negative symptoms. Pharmacotherapy mainly works for positive symptoms, but partial benefit only. And the data says that 80% of the people get relief with the help of pharmacotherapy, and 20% people, they will have some symptom or other. And moreover, the side effects also, especially these days, we are much worried about the metabolic side effects of the antipsychotic drugs. Here, coming to the other side, yoga therapy, lot of studies are done at NIMHANS and SVIASA, especially in schizophrenia. They are doing a lot of research, both biological research and also the social research they are doing. Negative symptoms and cognitive symptoms are the main focus of their research, because those are the problems which are not solved by modern psychotherapy. On the other hand, in our Balaji Vidyapeeth University, in our citer, F12 citer are now ISCM, a lot of work is being done in the role of yoga therapy and psychiatric conditions. Even recently also, a paper was published on the role of yoga in depression in collaboration with the psychiatry department. So similarly, so many other psychiatric disorders also being investigated and being treated with yoga. So our focus is about the negative symptoms and cognitive symptoms. I said negative symptoms are blunted affect, emotional withdrawal, poor rapport, social isolation, alausia, loss of abstraction, stereotyped thinking. So something like he becomes a vegetable like. After once the burning out of the positive symptoms occur, he may become a vegetable like, and we have to energize him with something or other. And modern pharmacotherapy is failing in this particular thing. Initially, when the schizophrenia term was coined, before that, the term was dementia precox. That means cognitive symptoms are there and something like dementia occurs at an early age. But later they thought that dementia doesn't occur at all in schizophrenia, because dementia is a different thing, atrophy of the cerebral cells leading to loss of memory and so on. But nowadays, it is found that cognitive symptoms occur in schizophrenia too. Cognitive symptoms are of 2 types: impaired social cognition, difficulties in identifying emotions, feeling difficulty in feeling connected to others, inferring the people's thoughts and reacting emotionally to others. So that is at the deficit. Impaired neurocognition, several domains including attention, working memory, verbal learning memory. So these executive functions are at a defect. If we just broadly say, the first thing is social cognition is something akin to emotional intelligence. Like the second thing is the intelligence G factor. Like so, these things also are impairing in schizophrenia. What we can observe. So, what are the research gaps? What are we going to do now? Extra. The problem is lack of motivation. Here, the schizophrenic, chronic schizophrenic, he has negative symptoms and he doesn't have motivation. And if we give yoga therapy, he may get motivated. But even to do that by yoga therapy also, he requires some motivation, is it not? So it is something like a catch-22 situation, whether we can really apply our yoga therapy to these people or not. Many studies were there. Sample size was something like 40 or 50 or 100 and so on. But larger samples and also some pre-intervention, post-intervention studies, but without controls, some studies. Restricted to very few centers. Some centers like SVASA or NIMHANS, as I was telling, are the pioneers in this one, but not many centers have taken up this one. Variability in techniques and duration. International studies, there they apply something. They apply some yoga technique which belong to the school they know. And another center offers something. So, there are many schools like Iyengar yoga and so on. So some people apply Kundalini yoga, like some people apply some asanas, some people apply some Surya Namaskaras. Variability in techniques. Can we compare all these things? So there is a need for the uniformity, and there is no intergroup comparison. Does Surya Namaskara work better than asanas? Does Omkar Japa work better than some relaxation yoga like Kaya Kriya? So no studies were done in this particular area. So we have taken up this one to compare various different yoga techniques and their role. Has yoga got any role in benefiting patients with chronic schizophrenia? This is a research problem in general. So let us try to split into or analyze into different things. Before going for something like a glossary, see, assessment tools, these names may be new to at least some of them, some of you. So I thought of introducing 3 tools before going for the hypothesis. NSA-4, negative symptoms assessment, and BCATS, brief cognitive assessment tool for schizophrenia. Mini-C test, social cognition and emotional assessment test. And of course, weight, because obesity is the main complaint with the antipsychotic drugs of the modern medicine. So just because it doesn't cost anything, it doesn't require any effort. So this particular weight is also added to this study. Dependent variables, independent variables, intervening variables. Let us try to understand dependent variables. Negative symptoms, NSA-4. Neurocognition, BCATS. Social cognition, Mini-C. And weight, the change in the cases, how many cases he gained or he lost. Independent variables. We have got yoga groups, Surya Namaskara group, assorted asanas group, pranayamas group, Om Japa group, relaxation group, and energizer group. And of course, we have got exercise group, aerobic exercises. And compliance. See, this is the one which I think in our study we have taken, but neglected by many studies. Simply they say 100 patients are taken, out of them 80 completed the study and 80 are taken up. So did they do all the 3 months without a break, all the things? Are they doing all the components of Surya Namaskara without any lacuna in any particular component? So are they really doing the way which we have described, or doing something else? So compliance may be full or partial. So partial compliance, so something like all or none phenomena in other studies, usually that is done. Here we have taken care of that one also. And also, of course, no intervention we have taken care of. And intervening variables, whether these things have got any role in influencing the outcome: age, gender, marital status, education, occupation, social status, economic status, religion, chronicity, mono versus polytherapy. So these things are taken care of to see whether any influence of these things are there on the outcome. Then coming to the hypothesis, naturally, as we all practice, we don't accept the actual or alternate hypothesis. We formulate the thing in a reverse way, null hypothesis. We think that null hypothesis is correct, but unless it is disproved, so let us try to put a null hypothesis. H0, 1. Yoga interventions are not more beneficial than no intervention in improving the NSA4. Yoga interventions are not more beneficial than aerobic exercise in improving NSA4. Yogic interventions are not more beneficial than no intervention in improving BCATs. Yogic interventions are not more beneficial than aerobic exercise in improving BCAT score. Yogic exercises are yoga interventions are not more beneficial than no intervention in improving mini-C scores. Yogic interventions are not more beneficial than aerobic exercise in improving mini-C scores. Yogic interventions are not more beneficial than no intervention in reducing the weight. Yogic interventions are not more beneficial than aerobic exercise in reducing the weight. Then individually, Surya Namaskarams, assorted asanas, pranayamas, Om Japa, relaxation yoga, energizer yoga, and exercise. They are not more beneficial than one another in NSA sports. These are all, and no these are all and exercise and no interventions are not more beneficial than one another in improving BCATs. And these are all are not beneficial than one another in improving mini-C scores. And also, all these things are not more beneficial than one another in reducing the weight. Then the complaints for some people have done three months with either exercise or yogic intervention. Some people have done only 2 months. Some people have done 1.5 months. Longer duration of all these things have any more beneficial than shorter duration in improving NSA4 scores. And all these things have anything to improve BCATs one another, more beneficial. And mini-C also, and also the weight also. So total, we put 16 null hypothesis. And of course, all alternate hypothesis. I don't want to take your time by repeating all these things. So all these things are the negatives of null hypothesis. Yoga interventions are beneficial than exercise in improving NSA4 and so on. And so all these things are alternate hypothesis. We have got HA9 to HA10, HA11, 12, HA16. So all the things. So sample size calculation. There are many formulas in the sample size calculation. Easy one and simply confidence level alpha 5%, beta 20%. So this is the standard one. 1 minus beta 80% is the power of the thing. And assumed standard deviation 0.2. And the confidence error E is equal to 0.1. So the formula, it leads to 62.79 as the sample size for each arm. And inclusion criteria. We have not taken all the schizophrenic cases because there will be dilution. Acute cases naturally will have dilution. Negative symptoms and cognitive symptoms we see in chronic cases only. So we restricted to chronic schizophrenia. Chronic schizophrenia we call when the duration is more than 2 years. On the same minimal maintenance dose of antipsychotic drug. See, if we keep on changing the antipsychotic drug, we do not know whether antipsychotic drug is giving the positive response or yoga is, we are not sure. So on the same minimal maintenance dose for at least during the last 6 months. yoga naive, not practiced any yoga technique during the last 1 year. Might have done during the childhood also, but not recently. Informed consent of the persons and their accompanying persons. Here one limitation is, when we try to take the signature of the people, they hesitated to that one. So we have recorded. They know that we record everything there. We operate everything through Zoom only. So Zoom recordings would be there. They know that we are recording it, and verbally we have explained the thing. And after the acceptance, we have followed the thing. We have proceeded with the thing. Exclusion criteria. Any physical disabilities or health problems which may interfere with the practice of any yoga technique. Religious or cultural factors which are likely to interfere with the practice. Regular practitioners of yoga and those who are undertaking any special training for improving their psychological skills. Some people may be undertaking some cognitive therapy for their positive thinking, or some people may be practicing some hypnosis training also for improving something. So any improvement for the psychological skills, if they are undertaking anything, we are just leaving them. Illiterates who can't read the thing, so those people are also excluded. The interventions, already I have mentioned the interventions, but I go into detail now. The group 1, Surya Namaskaras. Surya Namaskaras, all the yoga intervention modules are 15 minutes duration. Every day they have to do 15 minutes, and starts with the prayer, and they do Surya Namaskara 3 rounds with 1 minute break for each time, and then ending prayer, and so on. Group 2 also assorted asanas. So assorted asanas also starting prayer, and asanas like Talasana, Merasana, Bhujangasana, Pavana Muktasana, Eka and Dvi, Shavasana, and ending prayer. Group 3, we have Pranayama group. The most popular Anuloma, start with the prayer, Anuloma Viloma, quiet sitting for 1 minute, and Anuloma Viloma Pranayama 9 rounds for 3 minutes, and our unique pranayama, the Pranav Pranayama, 3 rounds of each component for 9 minutes, and ending prayer. And Om Japa, starting prayer and quiet sitting for some time, Om Japa chanting for 10 minutes, and ending prayer. And group 5, relaxation yoga, starting prayer, Kaya Kriya, 3 rounds of each component for 1 minute, and Shavasana with Savitri Pranayama, and ending prayer. And group 6, energizer yoga. Energizer yoga, we with the prayer, Kapalabhati Kriya, and Surya Namaskara, Surya Nadi Pranayama. Surya Nadi Pranayama is supposed to energize the person, and Kapalabhati is also known for that one. And also Topukarnam, supposed to be the power producing the energy to the brain. So these things we have done. Group 7, basic aerobic exercises of school level. We have chosen the things which doesn't produce any physical strain, also easily understandable, and we made a video of that one to follow that one also. And group 8, this is the defaulter group. Actually, we have not defined the defaulter group initially. They have become the defaulters by default. See, those are pre-intervention assessment was done for them. And they were given a particular intervention also. They are periodically followed up also. When we phoned up, they said, we are doing. That was the standard answer. And after 3 months, they got a sorry figure saying that they could not do. Those people who could not do more than 15 minutes, they fall into the group 8. So we have done pre-assessment, pre-intervention assessment, but the intervention was not followed. And now they are available for us. So post-intervention or the assessment after 3 months is done for them. So they become the control group with no intervention. They are deemed to be so. And the assessment, NSA4 for negative symptoms, I said neurocognition test contains animal naming fluency test, trial making test, digit symbol substitution test, and social cognition test. It contains face emotion recognition test and faux pas recognition test, which is part of mini-C test. NSA4. Here, 4 items are the key items, and the 5th one is the global assessment. Higher the NSA4 score, more severe the negative symptoms are. So the difference between pre-intervention score and post-intervention score, we have taken it as the positive thing for improvement. So this is what is done. So the 4 items are regarding the speech, regarding the emotions, regarding the social drive, regarding the interests, and global rating. So maximum scoring would be 31. Minimum scoring would be 5. That means 5 means he is absolutely normal as far as this aspect is concerned. 31 means the worst possible case. See, for example, a person got 24 now, pre-intervention assessment wise. After intervention, his 24 become 20. That means he gained 4 points on the scale. So we will be putting 4 as his score on NSA4. For example, he was 24 before intervention. He became 25. That means he has a -1 score on his scoreboard. Then regarding the BCATs within 1 minute, how many animals you remember? Just write down. If his writing is so slow, our people will be writing for him, and he has to utter that one. Peacock, lion, and so on. If he breaks for 15 seconds, then we have to say, what I'm asking is, I'm asking about animals like dog. So just we have to give just a provocating or stimulating statement. So that is the way we are going to apply that one. And this trial making test is from 1 to A to 2, 2 to B, B to 3, 3 to C. He has to alternately, he has to put the line between one letter and the number, and the letter and the number. And within 1 minute, how many lines he could draw, that is the score of him. And the third one is symbol substitution test. Here what happens is, we are given a number, and the number has to be substituted with the symbol given there. He has to put the symbol, and after seeing that one. So this is all neurocognition testing things. These are all validated ones. Then regarding the mini-C test, actually the Western mini-C test, it's very difficult for our people to interpret the emotions of the other cultures. And similarly, the certain situations which are considered to be somewhat not so acceptable socially, we cannot judge them because of the cultural differences. So we had to devise a test, an Indian adaptation of that one, with both this face emotions recognition and also FOPA test. So this thing also we have practiced. Data collection. Data collection, the flow chart. Initial screening for cases at reception. 100, those who are carrying prescription of 100 days with antipsychotic drugs. And they are taken to the verification of the diagnosis is done from the computer by the hospital manager, whether this person is fit for this trial or not. Then that the person with the family will be brought. Final approval and informed consent to be taken by this researcher. And the next one is the initial data. Case workup is done by psychologist. Preliminary data sheet, administration of psychological tests are done. Then interventions. Interventions training is done by yoga instructor. And then the booster training, online group practice we attempted, but somehow the people were not so enthusiastic in joining the group online practice. So we were giving advice only on phone. And follow-up after 3 months, verification of compliance. We have verified the compliance by asking, are you doing that one? Yes, we are doing. Then how you are doing? You just show it to us. Some people who said that they are doing, they could not do it, and they accepted the truth that they did not do. So those things, the verification was done. And reallocation into the default list. Final assessment by psychologist, the post-intervention assessments. So this is the thing what we have done. So the concept, total follow-ups seen during the 94 days. You may ask, what is that 4 days? Because of the curfew, although we opened the hospital, nobody could come. So those 4 days had to be added. During the 94 days, we had the follow-up of 4,887 people. Actually, that is a less figure, 50% of our usual practice, but that was the corona period. Then inclusion criteria fulfilled. For schizophrenia, 1,215. Exclusion criteria applied, 445 were excluded. After applying exclusion criteria, cases taken for study were 770. 770 were taken for cases, and pre-intervention assessment, intervention was taught, and during the 3 months time, only 667 came. What happened to those 103? They came almost, most of them came, but 1 month later or 15 months later because of some difficulties also. So those were not taken. We did not open our shop eternally. We closed after a particular date. Reasons for refusal. Some people, out of the 1,250, some refused, is it not? So who are the people who refused? We wanted to just know out of curiosity whether it forms the part of the study or not. But out of curiosity, we asked them. Some people said, I have got urgent work, I cannot undertake this one. So that number is 37. Vehicle, I came by an auto from a distant village, and that auto fellow is ready there, and he won't accept waiting there. And somehow I'm diffident about doing yoga, sir. Please leave me, sir. So this type of thing. I don't have any interest. So this type of practicing already yoga. Initially, they said that they were not practicing yoga, but later they said practicing yoga. Surprisingly, religious reasons, no non-Hindu person refused on the ground of religion. Only we were very diffident to allocate them into Om Japa. So we have slided. Some people are depending on their response. The response is, do you want to do Om chanting? Oh, yes, sir. Why not? If it is helpful, we do it. Do you attend church? Yes, I attend church. Did your pastor say any time not to hold any bangles, not to wear kumkum, not to utter Om? Yes, regularly he says, sir. Then if he comes to know about this one, will he accept this one? I don't think he will accept, sir. Then okay, then we'll slide into some other group without where there will not be a problem of that sort. People are not told that they are going into exercise group. The whole thing is yoga study group only. Whether they are doing aerobic exercise or some yoga thing, all the things, something or other is doing, but they are not uttering anything akin to a particular religious thing. So here the important thing is, religion will not be a barrier for individually if you want to do that one, except the social factors. Then all the eligible persons. How we have randomized this one? We have taken up randomized block sampling. Whenever we say randomized block, immediately what comes to our mind is randomized block for places. Nagpur city, Calcutta city, and this one are states, Tamil Nadu state and Haryana state there. So here, randomized time blocking, we have blocks we have taken. Monday, Surya Namaskara group. Tuesday, assorted asana group. And Wednesday, pranayama group. Thursday, Omkar Japa. And next, relaxation yoga. And so on. So Sorry. And lastly, the energizer group, 6th day. And lastly, aerobic exercises. So these things, the aerobic exercises stand by sliding into that one. So this is the way which we have randomized, and psychological tests are administered by psychologists, and yoga interventions are done by yoga trainer, and almost all our nursing staff, they have learned it within a day or two, and they started assisting him. And also the follow-up also is continued. And YouTube links are also given. Everything is recorded. Every group is recorded. They are given a link. And on the phone also, we try to verify whether they could open the YouTube link properly or not, whether they are regularly seeing it and doing it or not. Coming to the defaulters, whether any particular intervention is highly represented in the defaulters. Surya Namaskara 17, assorted asanas 31, pranayamas 25, Om Japa 34, relaxation group 12, and energizer group 12, aerobic exercises 26. So all the defaulters group 8, 155. So those are represented by all these things. And I have put in a pictorial form how much percentage in each group I have put. Surya Namaskara, assorted asanas, pranayama, and so on. Yoga interventions. So defaulters are gone. Those who have done, so Surya Namaskaras 84, asanas 66, and pranayamas 81, Om Japa 92, relaxation yoga 61, energizer yoga 53. So total cases assessed were 667, yoga group 437, exercises group 75, and defaulters group 155. So ultimately, so these 667 we are going to take for analysis. Data analysis, let us go into. Statistical design, SPSS, actually the work was done on 16, but now I procured 26th version. There is no much difference except for making the charts. Excel also I have used GraphPad online, social statistics website, one-way ANOVA, t-test for independent samples, correlation Pearson's, chi-square test. These are the things which I have used, statistical tools. Gender, we have got 322 males, 345 women. Age-wise also we have recorded. 18 is the minimum age. So 18 to 20, some 18 people are there, 20 to 29, and so on. And even above 60 also, we have got 25 people. Marital status-wise, we have recorded married, single, widowed, divorced. So these people married are more, 436, and the rest are I have given the descriptive statistics. The level of education also, elementary 137, and high school 264, college 124, and university 82 level education. And religion wise, Hindus are 557. Actually, one Jain is also there, and that particular one Jain I did not want to remove. Legally, as per the law, as per the Hindu Marriage Act and all, Jains and Sikhs are also considered as part of Hindus. So that one particular one is clubbed with Hindus. And Christians 102 and Muslims 8. Social status wise, social status, we have got BCs, OCs, SCs and STs, and those are also 271, 288 and so on. And economic status, when we ask their income, they will definitely tell something wrong. Either they boost up or they say low, suspecting something that they will be charged extra. So that's why which ration card, even this one also we cannot rely, because even a wealthy man also may procure a white ration card to have the rations. White ration card holders 551, supposed to be below poverty line. Pink ration card people above poverty line. So this is the way we have classified. Occupation wise, blue collared and green, white collared, and housewives and unemployed people. Housewives represented more. Almost most of the women, they are housewives. And the duration of the illness, just 2 years duration, many people represented. Even 35 years duration also is there. So the range is 35. And the mean age is 10 years with a standard deviation of 7.9. This is about the chronicity of the illness. Initially, we thought of taking monotherapy, but polypharmacy is a common thing. Multiple drug users are 228 and single drug users are 439. Comorbidity, we recorded the comorbid things, but we did not want to analyze that one because diabetes may act in a different way and asthma may act in a different way. The comorbid conditions are also recorded, and so no comorbidity 460, comorbidity 207. The compliance part, full compliance. The yoga full compliance 314. Half compliance are 2 months, did 1.5 months, 1 in 123, total 437. Even for exercise also, 60 people, they have done total for 3 months, 15, some defaults. Defaults in the sense not full default, the partially. That means they did 2.5 months and so on. So total this way, total full compliance 374 and partial compliance 138. So this we are going to analyze. These comorbid conditions, this is the list of the comorbid conditions. Just the weight, mean weight is 70, standard deviation 14. 70 kgs. Now let us come to the core or nucleus of the presentation, NSA4, that is the negative symptoms. In what way this NSA4 is influenced? Effect of interventions on NSA4, yoga versus exercise versus defaulters. See here, yoga has got the benefit of 8 points, whereas exercise only 5 points, and defaulters even less than that one. So here, the yoga is definitely improving the negative symptoms. So null hypothesis, exercise and no intervention are not more beneficial than each other in improving NSA4. So null hypothesis is upheld. Yoga practice are more beneficial than exercise in improving NSA4 scores. So here null hypothesis is negated. Yoga practices are more beneficial than no intervention or defaulters in improving NSA4. So here also null hypothesis is rejected. The effect of individual interventions on NSA4. That means Surya Namaskaras, asanas and so on. All these things, whether there is any difference between one another. Surya Namaskaras, assorted asanas, all these things are not more beneficial than one another in improving NSA4. There is no difference between one another in NSA4. Exercise and no intervention are not more beneficial than each other in improving the NSA4. Surya Namaskaras and Energizer Yoga are not more beneficial than exercise in improving. See, as a whole, all the yoga interventions are, as a whole, totally, they are more beneficial than exercise. But individually, Surya Namaskaras and Energizer Yoga, they have failed to defeat the exercise part. So here, Surya Namaskaras and Energizer Yoga, they have failed in winning over the exercise, but they are more beneficial than no intervention. Assorted asanas, pranayamas, all these things are more beneficial than exercise. That is the repetition of the statement we can say. Yes. Compliance of interventions on NSA4. Compliance, full compliance, partial compliance. Exercise, full compliance, defaulters, partial compliance, yoga, full compliance. So this thing, yoga full compliance is always better than partial compliance. partial compliance of yoga is better than exercise and defaulters. It's so. Effect of compliance on NSA4, yoga practice full compliance are more beneficial than exercise and interventions and defaulters. Interventions of partial compliance are more beneficial than no intervention and exercise in improvement. Effect of compliance of individual interventions on NSA4. When we look at this one, I try to pass on the slides somewhat fast so that we can conserve the time. Assorted asanas and relaxation are more beneficial than exercise in NSA4 scores. Group 1, 2, 3, 4 full compliance are not more beneficial than partial compliances. Now coming to the BCATs. BCATs is about the neurocognition, you know. Effect of interventions on BCATs. Yoga and exercise are equally good compared to defaulters. That's in one line to say that one. You can see the graph also there, the scores also there. Yoga, exercise, defaulters, and so on. Statistical significance is yoga practice and exercises are more beneficial than defaulters in improving. Yoga practices are not more beneficial than exercise. So both are equally good as far as BCATs are concerned. When we come to the individual interventions and their scores, here what we find is, you can see here the defaulters are failing compared to the full the yoga practices and exercises. And the effect of compliance, partial compliance and the full compliance, you can see in the graph, all the first 7, the full compliance groups are better than the defaulters group, and also the partial compliance group. Here also you can find all the interventions are better than defaulters or partial thing, except relaxation yoga. Relaxation yoga has failed compared to the partial thing. It is not better than partial thing. So that means doing something partially also is better than relaxation yoga. At that particular point only it failed. Otherwise, yoga in general is doing good. The effect of complex individual interventions. All yoga practices except the relaxation group, their full compliance are more beneficial than partial compliance. Interventions are partial compliance or no intervention interventions of partial compliance are more beneficial than no intervention. Then coming to the mini-C. In mini-C, effect of interventions on mini-C. Here also you can see both yoga and exercise are doing good compared to defaulters. But yoga and exercise, both are equally good, and now none is better than the other. Yoga practice and exercise are more beneficial than defaulters in improving the mini-C. Yoga practice are not more beneficial than exercise in improving. So both are equal, we can say. Individual interventions on mini-C. Here also just somewhat a different finding, which is an interesting finding, that asanas and pranayamas. Here the pranayamas and asanas, pranayamas scored better than pranayama. Yogasanas scored better than pranayamas as far as the mini-C scale is concerned. The effect of individual interventions. All yoga practice and exercises are better than defaulters. Assorted asanas are more beneficial than pranayamas. The effect of compliance, partial compliance and full compliance. Here also we can find that the pranayamas have not scored better compared to the partial complaints, but the rest of the things I have scored better than the partial complaints. Statistical significance. All yoga practices except pranayama and exercise group are more beneficial. Interventions of partial complaints are better than no intervention at all. Coming to the global outcome, see individually negative scores, neurocognition, social cognition, okay, we have done. When we club all these things, what happens? Let us try to apportion, allocate 33% for each group and combine the scores. What will happen? Let us see. The global outcome. When we see this one, global outcome, improvement of neurocognition, social cognition, and negative symptoms, the summated outcome, the effect of individual interventions, whether there is anything to do with the global outcome, when we have seen this one, the duration, the exerciseful, defaulters, this one, statistical significance is, we find that yoga practices and exercise full complaints are more beneficial than partial complaints and defaulters. And interventions of partial complaints are more beneficial than no intervention at all. So this is the expected thing out of all these things. And the effect of complaints of individual interventions, when we have seen this one, we found that all yoga practices and exercise group are beneficial than interventions, we can conclude. Then regarding the weight gain, I do not want to take much time on this one because there is no change at all, almost very minimal change. Just 0.05 or so is the change on an average, and all whether it is exercise or whether it is a yoga intervention, there is no much change in the weight. Just the loss of a little, that is 0.5 kg or so. Then coming to individual interventions, weight. So coming to the age, whether age has got anything influence. Here you find that age has no influence at all on NSA4. Here you can see no significant at all. And coming to the B-cats, no significance at all. Age has no significance with the mini-C. Age has no gender. Gender also, NSA4, mini-C, B-cats, all are nil significant factors. Education-wise, education also, mini-C, NSA4, no mini-C scores and NSA4s, no significance at all. Why I have kept B-cats is there is a significant result as far as the education is concerned. That's why I kept it aside. As far as the B-cats is concerned, elementary school people, they scored less. See, you can see the significance here. 0.001, 0.000, 0.004 p-value. So that means elementary education people, they have scored less. It is obvious, it is understandable that although they say that I have studied 5th class, they say they score less in the number symbol substitution test and so on. Marital status, there is no significant result compared to each group. P-cats, mini-C, no significance at all. Occupation-wise also, no significance at all. On B-cats, mini-C scores also, no significance you can see. Economic status also, there is no significance. Pink ration card and white ration card, no significance at all. Social status wise also, there is no significance at all. No significance. And Minisi also no significance. Religion, we found an interesting thing here, that Muslims are also clubbed with Christians, Hindus and non-Hindus. They have scored less on NSA 4. That means negative symptoms compared to Hindus. Somehow we found that the non-Hindus group, they could not gain much out of the negative symptoms. Here is the limitation of the study, because we try to allocate them into the exercise group, and most of the non-Hindus are in the exercise group, and naturally, as exercise is scoring less, they have scored less here on NSA 4. I think we can interpret it that way. So now, monotherapy and polytherapy, there is no difference at all between these three things. And so all are non-significant things only, or even the chronicity also. The age of the disease is not going to influence. So that also we can conclude. Correlations with scores. And now the concluding part. This is the qualitative part. Till now, quantitative statistical research, qualitative part, how they felt, what they felt after intervention. So these are the expressions. We have not prompted them. Just whatever comes to your mind, you say. It is something like content analysis. Whatever the content they have given, we have put into the categories. Calmness of mind, active more, lightness or healthy feeling, joyful, weight reduction, working well, laziness reduced, unnecessary thoughts reduced, anger and irritability reduction, concentration improved, motivated feeling, sociable, breathing well, energetic, self-confidence, positive thinking, diabetes control. And some people even said that we are so happy with this one that we are doing twice a day, sleeping very well, tension reduced, weakness control. And belly fat reduced, drowsiness reduced, memory improved, sharpness, stress reduction, speaking well, fit feeling, back pain control, driving for long distances now. So these are the things which we do not put into their mouth. Those come from their heart. Emotions control, headache control, and so on. Similarly, nasal allergy control, leg pains, thyroid problem controlled, wise decisions I am making, time management more. I am doing thrice daily, somebody once said. And but negative things are also expressed by some. How many? 11. Numbness of the limbs occurred by doing this yoga. Body pains occurred, headache occurred, no result at all. So this type of expressions also we have recorded. So these are the expressions post-intervention things. Defaulters 155, why they have stopped, why they could not do. Their number also recorded. Work pressure, lack of time, not interested, laziness, ill health, can't get up in time, could not understand the technique, death of family members, agriculture. See, even smartphone lost also is one of the reasons. And naturopathy, we have gone to diet treatment. That's why we have not done this one. Accident, fear of aggravation of this one, pregnancy, examinations, felt inconvenient. And we don't have the proper space in the house. In India, rural places, very, very small places, or even in the urban, these things also. Ratings are done by our staff. How they have done this one? 5-star rating, 3-star, 4-star, and 3-star. Very poor, poor, satisfactory, very good, excellent. So these things. Criteria for rating, number of days practiced, and the time they have done for the intervention. Total components they have done or not. Correct method they have followed or not. So 5-star, 4-star, 3-star. So defaults are naturally belong to 1-star or 2-star. So here the surprising finding is Surya Namaskara group and Asanas group, they scored less than 5-star. That means Surya Namaskara, one component or other they are missing. Asanas out of 5, one component or other they are missing. So this is an interesting finding. That means we should not go for a complex amalgams. Simple things only. Chi-square test, you see 0.0000 p value. So statistically highly significant this particular finding is. And coming to an important issue is mini C test. Original thing looks like this. And Indians, I don't think can infer the facial emotions this way. So we have designed our Indian version of this one, Sighter Manasa Mini C test. It is Manasa Hospital is my profession, and Sighter is my guru's place or my place, where I am learning the things. So this is a guru shishya interaction in the form of development of a new tool. And I owe my gratitude to Guru Ananda Balayogi Bhavanani ji for this one. So how we have developed, I take 2 minutes. He is a comedian called Ramanathan, very popular man. And he can express any emotion on his face. See these things, emotion we have to identify. Multiple choice questions like beseeching, fear, suspicion, sadness, happiness, overconfidence. So this type of things. So we have applied this one, and face emotion recognition test we have done for patients, and also the controls we have taken, the relatives we have taken as the controls, and 770 patients and 150 the accompanying persons we have done this one. So see how significant it is. Their score and the people score, the patients score 6 and 8. So it is a significant thing. Even the FOPA test also, the situations which are applied for other countries may not be suitable. So here the 5 situations. I'll give you one example. One example only. The 5 I don't give because paucity of the time. A middle-aged couple, they are just strolling in park. Suddenly, one stranger approached them and started smiling, and came close to that woman, saying that, "Don't you remember? I'm your classmate. We were just going to movies every week, bunking the college." How embarrassing it is. So that embarrassing meant one has to find, and that why it is embarrassing, one has to explain. 1 mark or 2 marks. So similarly, these embarrassing situations which are somewhat nearer to our culture, we have made this one. Here also, the patients scored 4.5 and the normal controls, they scored 8.3. So it is highly significant. So we can take it as a, and even the global one also, combining these two things also, patients population mean 11 and the control population 16. So we can take it as a pilot one, and we can use it on larger population and different populations, not only for this yoga, other things also, whether we can standardize it fully. Then coming to the conclusions part, trivia. Surya Namaskarams and energized yoga are not more beneficial than exercise in improving NSA4. So all the yoga are better, but except these two things in overcoming, in beating exercise. All yoga practices except the relaxation group, that is all, these things are more beneficial than interventions, partial or default. Assorted asanas are more beneficial than pranayamas in improving the mini C scores. So these are the trivial things, what I say. And some more trivial things are quality of practice as rated by trainers is poor with Surya Namaskaras and asanas group compared to other groups. So that's why complex things I think we have to avoid. Elementary education could not perform well on BCATs. So BCATs, we should be careful that not only just elementary education, at least high school education we should be. Christians could not perform well on NSA4, maybe because of the fault in the design, fault in the sample selection, we can say. Then outcome in a nutshell, that is the conclusions. Very large sample of 667 patients of chronic schizophrenia. That is, I think, maybe a record one. Both yoga interventions and exercises are better than no intervention. Here, the thing is, even exercises also, they have done mindfully. doctor has said that this is a part of their therapy part. So that the yoga, but even the exercise also they did mindfully, and so that may be the reason. Yoga interventions are better than exercise for negative symptoms. Positive attitude and mindfulness are the key elements. Longer duration and regular practice gave better results. Simple interventions are better than complex amalgams. Religion is no obstacle for yoga therapy. And all or non-phenomena doesn't exist. Intermediate practices are common. Limitations of the study are online group practice could not be fruitfully conducted, biased allocation of groups for non-Hindus with the fear of losing the case, and lack of motivation is the problem to be solved and is the obstacle. What next? The next is refining and fine-tuning of my data analysis with the suggestions given by the colloquium. Next level is submission of synopsis. The next level is writing of the thesis. The next level is grand finale of thesis submission and YOOC. Chapterization. Actually, the standard way I planned is introduction with all schizophrenia, negative positive symptoms, role of yoga therapy, research problem, objectives and hypothesis, review of literature, both the psychiatric research and yoga research, Indian studies and international studies, research gaps, and material and methods. So research design, assessment tools, interventions, sampling methods, statistical methods, and results and data analysis, and interpretation, discussions, and implementation. So this thing. But our SBV university, they give a protocol, like a standard template, like so 14. I think those 5 only we can separate into 14 groups as per the requirement. I think I can be doing it. Now the time is 12:40. So much of your valuable time I have taken. Thank you very much for your valuable time, valuable suggestions, valuable presence. This is not really mine. I'm only a tool. I'm only an instrument. This is the presentation of SBV University, ISCM. And this is the end of my presentation. Thank you very much.
Thank you very much, sir, for that excellent presentation. I think everyone who has been part of today's presentation will appreciate the amazing attention to detail that you have taken painstakingly. At this time, I would like to request our most esteemed Bhishma Pitama, Professor Madanmohan ji, to make his comments, and following that, our most esteemed Panch Ramalingam sir, we will be inviting. I request Madanmohan sir to give comments, sir. Namaste.
Our different process is report.
Yes, sir. Madanmohan sir. Namaste.
He has given very nice presentation, details, and very interesting findings. Last time also we discussed the points, and I don't have any questions. Everything is very clear. Very clear. He presented well in detail and with enthusiasm. Everything is covered. Yeah.
Thank you very much, sir. I request Panch Ramalingam sir for his comments.
Sir, thank you very much. This is a very extensive study he has done and also well presented. That all the credit goes to him as well as the guide. I am appreciating his work. I have 2-3 comments. One is along with his presentation, let him enclose what are all the pictures he has captured during the study, and if possible, let him also include the video, so that the others can also make use for their further research. In addition, I could find he has mentioned the 155 defaulters. That if possible, what is the means to reduce the number? In a constant study, he has done it in an extensive way. How this defaulter is the number is more than this other two sections. That he has to focus and, if it is possible, let him reduce something. And that is the only comment I may have. Otherwise, is having our appreciation. Even today, you can announce he is eligible for his PhD. That is my personal comments. Thank you very much, sir, for giving the opportunity.
I'll follow your suggestion of defaulters, sir. Defaulters are all already in the follow-up list, and I'll continue my study even after the PhD is over, sir. Thank you, sir.
Great, sir. Great.
Wonderful.
Take care, sir. Thank you very much. Congratulations for your extensive work on this particular area. That too, during the COVID period, you have done a wonderful job. Thank you very much.
Thank you so much, sir, for those beautiful comments and the pointer towards the defaulter list. I request Rama Reddy sir to keep a note of that and include that fact that they will be followed up and will not be left alone as part of our next presentation. I request our co-guide, Dr. Vijaya Gopal sir, to make a few comments here, sir.
Sir, it is a very great study as far as you know. Probably in the last leg of the presentation that Rama Reddy has really, in our psychiatric circles, it is a great wonder. Nobody can do such a work. So probably, and also its results and other things are very encouraging. So when it is really taken up by the psychologists and other people, it will this study will be benefit probably with many papers which coming from this particular thing. May be an eye opener about yoga and other things. I congratulate you and Dr. Rama Reddy sir. Namaste.
Thank you, Vijay Gopal gar. Thank you.
Thank you so much, sir, for those pertinent comments. And we are hoping that at least a dozen papers should come out in the next 2 years from this, because extensive data mining has been done and a lot of potentials to take it forward. I request Dr. Meena. I'm not able to see her video. Balaji, can you just check out? I think maybe there's a video issue. Please find it out. I would like to point out here that we have the new tool also developed, which gets hidden in the thesis. And I feel that that should have a separate highlight. So I request Rama Reddy sir to take that forward also. As we go on, we'll have a discussion on that.
Sure, sir.
Yes. Requesting Dr. Meena to make a few comments at this point.
Yes, sir. One is like, congratulations. We have been listening to you throughout in all the RACs, and something which has, motivated us and kept us thinking a lot in so many different ways, especially how to take up a PhD thesis. How can we, what are the different things we can assess? What are the different things we can look upon? So many other factors, sir. You have been a motivating factor in all this. And the other thing which, in general, whatever we have been discussing, that, the yoga group is always done better than the partial defaulters and then the defaulters. So that chart, which means it is again motivating that the traditional angle which we are following or the practical angle which we are thinking about is, again re-established now. The other one is like the way you have analyzed it, the distribution of the subjects or into the groups, whatever it is, randomization, the records that you have maintained in all these different, scales, the compliance scales, whatever be it, it is like phenomenal. That is the only thing I can say. Thank you so much that, I feel so blessed to be a part of this thesis work in whatever little way possible. That's it, sir. Thank you.
Thank you very much, madam. Always you are, see, even all the protocols, all the things, even when one thing our people could not do, you yourself personally did it and gave the video to us. So very grateful to you, madam.
That is part of what we are here for. And I again consider it a fortunate thing to be, involved in any small bit that is possible. That's all, sir. Thank you. Thank you, sir.
I would like to open the session up to anybody who would like to make any comments or ask any question. You can please raise your hand and we will give you a chance. A couple of questions or comments, you can just raise your hand so that I know to unmute you. That's the reason. Well, yes. Namaste, Prasida Menon, namaste. Yes, namaste, welcome.
Yes, sir. And namaste to all of you. And I would like to congratulate Professor Rama Reddy sir for such a wonderful, such a detailed, such a elaborate and an entertaining presentation. Usually it is very boring when we listen to these academic presentations, but surely with all the animations, it was very entertaining. I do have a question. I don't know how much of it I remember from all the slides, but I don't even know if this question is correct, but probably you could correct me, Professor Reddy sir. Has it come out that yoga interventions as the whole group of all the interventions and exercise, they're kind of equivalent? So then if you could throw light on what is the difference between yoga and exercise that you found in your work? Or is there anything that we can say that yoga has stood out or it's equal? How is it? Thank you.
Madam, we are having three components here: negative symptoms, neurocognition, and social cognition. As far as the neurocognition and social cognition, there is no difference between exercise and yoga interventions. But as far as the negative symptoms are concerned, yoga interventions excelled over exercise. So that is the significant finding. Even anything, whether it is exercise or whether it is asanas or pranayama, when it is done devotionally, it is going to affect something. So that is seen in those who have undertaken intervention, something like a divine thing, and those who have not taken it seriously in the form of partial complaints, those who have neglected or for some reasons they have not done. So that difference is there. So that the faith part and mindfulness part works both for yoga and also for exercise. But yoga really works for negative symptoms as far as NSA4 scores are concerned.
Thank you very much, sir, for that.
Madam.
And what you had also said, what I remember was in psychiatry, or probably even in clinical psychology, I don't know. But psychiatry, there isn't really a method to take care or deal with negative symptoms. Is that right, sir?
Couldn't get it, madam.
Yeah.
I was just saying that initially in your presentation, you had mentioned that for negative symptoms in psychiatry, we don't have so much of a cure. So what you're saying is yoga could help very well with the negative symptoms, considering the non-pharmacological aspect, which psychiatry doesn't offer as a cure.
Yes, madam. See, here, different, initially it was only the dopamine receptors which were incriminated as far as schizophrenia is concerned. Now they found that interaction of different receptors are responsible for this one. Precisely attacking a particular receptor and improving the thing is an impossible thing. That is the reason why initially when the classical antipsychotic drugs were designed, lot of extrapyramidal symptoms, like almost like Parkinson's disease patients, we were having the patients. Now the designs are improved so that positive symptoms are much handled without much extrapyramidal symptoms and all, but at the cost of getting metabolic syndromes like gaining weight or diabetes aggravation and so on. So there are lacuna. And as far as the standard statistics concerned, 80% of the schizophrenics, they benefit with modern antipsychotic drugs. Negative symptoms, of course, some may get benefited with the traditional antipsychotics, but still those are the main which are the problem here. And NIMHANS is working with the integrated medicine on those things only. And we are also doing the same thing by considering yoga. And even from the psychological aspects also, although psychotherapy may not help much in the psychotic symptoms, but for negative symptoms are concerned, CBT is also being practiced these days.
Thank you so much.
A very beautiful question, very beautiful answer. Thank you so much, Dr. Prasida, for being with us for this session and asking that question, because this has been one of the reasons this topic was taken, that for negative symptoms, we don't really have much. And what we have has so much of side effect. So can we have something like yoga, which is non-pharmaceutical, which has side benefits, as Madanmohan sir says. It doesn't have side effect, it has side benefit, he used to say. And I think it is a beautiful point that though for the other components, yoga and exercise are comparable, as far as the negative symptoms go, yoga is outshining exercise also. So that is a very beautiful one. And again, compliance, the role of compliance has been studied, which is often missed in most studies. So it is a very important aspect that full compliance is best, better than and partial compliance is better than no compliance. So I think this is a very good message we have got out of this. So we thank you for that wonderful answer, sir. We have a question from Vasundhara. I request you to unmute and ask your question, Vasundhara.
Thank you, sir. Am I audible?
Yes, yes.
Sir, first of all, congratulations, Rama Reddy sir, for a wonderful presentation as always. And sir, I have two questions. One is regarding the exercise. May I know what type of exercise? You mentioned aerobic exercise. I may know like how it is and whether it is like usually aerobics, it will be very bit dynamic and everything. And the second one is regarding the group. You were saying that you had divided the people into different groups as per the techniques they are using. So, and in Surya Namaskara means they will be only practicing Surya Namaskara, or afterwards, whether will they go for any other practice, and the duration. So these are the three questions which I have.
As far as the aerobic exercise is concerned, I searched in YouTube aerobic exercise for school kids, and I found some 5 or 6 videos, and out of them I selected the very simple exercise like moving the legs and moving the hands and turning one side or other side. So those things I took it for 15 minutes time, 1 minute for relaxation before and 1 minute relaxation after. And in between, this time will be occupied for that one. And actually, this is done by my grandchildren. My grandchildren, they did it for the particular time, and I recorded it, and I gave them. So even an ordinary person, even an aged person also can easily do that one. So that is the thing which we have devised, taken from YouTube. It is not a particular long thing which has got some scientific thing that this particular belly has to be melted with this particular movement and so on. We did not follow anything. Only for school children, something like a drill-like thing that we have followed. Then regarding the sliding, we have done to some extent. For example, the groups are allocated depending upon the day they come. On Monday, those who have come, we give Surya Namaskara. But some people on Monday, one 70-year-old man came and he cannot do Surya Namaskara. We slided him to the next day, asanas. Even asanas he can't do. Then Omkar Japa, Pranayama. Pranayama also he can't do. Then sliding to Omkar Japa. Omkar Japa is okay, sir. So in that way, we have done. Tuesday, all the people are asked to do asanas. But those who cannot do, they said, sliding to other things. But those will be continuing those will be in the same group till the end of the study. The 3 months, they will be continuously doing it. And their assignment is only for 15 minutes. 15 minutes videos are given, 15 minutes are taught to them. Again, repeated whether they are doing it properly or not. So that way we have taken care of. Is it okay, madam, or something else you asked?
Yes.
Thank you, sir. It was clear. Thank you, sir.
Thank you so much for that clarification. I believe Jency Shamna, I see your hand up. Would you like to share something? Yes, Jency.
Namaste, Ji.
Namaste, namaste.
Actually, I would like to congratulate, though I am not a person so worthy enough to congratulate the whole team, Ananda Bhavanani Ji and the scholar under his guidance, Ramamurthy Ji. Actually, as a social worker and beneficiary of yoga and a practitioner and teacher, I would like to extend a request. Please make this open to as many people as possible, and the findings should reach the people because it is need of the hour. I'll say just like that. During the pandemic itself, you have taken up the study. I request you to make it as fast as possible to reach the audience. And I have so many doubts sprouting up. Way back in 2005, there was a conference for people with disabilities. Differently abled was the term given to them then. Yoga was a part to treat so many people with. Am I audible?
Yes, yes. Please continue.
The thing is, cutting short to actually specific to schizophrenia, you have mentioned so many practices, and I'm astonished why Surya Namaskar is not able to make an effect on weight gain. That is one thing. Maybe the therapeutic diets may be part of it. And when it comes to care, when it comes to practices like this for people with schizophrenia, it is a peer group, it is the family who has to be taught first, then the thing. So the benefit can be multiple, and it can be sure. That's what is my little experience and my request. So when it comes to the follow-up, please let us know the findings so that we can also spread it, and we would like to be part of it. Thank you, sir. There are many questions. Maybe in the days to come, we will get in touch and get it clarified. As a research methodology things, there were quite a few things which I was not okay with, which I need clarification. And you mentioned about your tool. Please make it open to us also to learn.
Okay.
Thank you, Ji. Thank you, sir. Great work, sir. Great work.
Thank you, madam, for your compliments. One thing is naturally after the Viva is over, we will be open for publications. Many publications will arise, I think, from this work. So that will be open to the world. So that is one thing. The second thing is regarding the continuation also. Even now also we are getting. Yesterday I was preparing seriously. I was polishing the slides. Then my daughter, who is a psychiatrist who assists me, she came and asked her what is that. Then she was telling that, see, some of the patients she sees, even now also some people come to her saying that the yoga taught by your father, we are continuing still and we are very happy with this one. She was spontaneously telling, although she was not part of this yoga work. So definitely this is going to improve the things, what I feel. And regarding the parents' intervention, yes, we have involved not parents, but whoever have come along, we have done that one. Even during our journal club also, last journal club also, we discussed this one. Not only teaching yoga to the people, but also if you teach to the family member, both of them do together so that the compliance will be more. It is a very interesting point that family members have to be taken into this one. You said something, but later your audio was cut regarding the mentally challenged disabled people are so lot of work is being done in ISCM. Dr. Meena madam, she has done a lot of work on autism children, retarded children, ADHD children. Just we cannot imagine teaching yoga to such type of people. So such a work is being done in ISCM. Anyhow, regarding any methodology, if you have any doubt or so, you can just email to sir, Balayogi's Ananda Balayogi Bhavanani sir, or to me, so that we can clarify further. Thank you, madam.
Thank you so much, Jency, for that input, and thank you, sir, for that beautiful answer, and of course, taking it forward. So I would like to take this to the conclusion at this point. A very excellent presentation. Any other comments or suggestions? Devasena ma'am, neenga edavadhu sollanuma? Would like to say a few words, maybe unmute pananum. Unmute. One second. Ipa try panunga. Ask to unmute whether yes.
Namaste everyone. It's an excellent work, and it's with your dedication, actually, I can see that. So it's going to be helpful for many people from the social soul who is taken like a seva. That's what I felt, actually. It's so much work you have done, and going to be helpful for many people in this, I mean, this condition, and of course in the future. Thank you so much. Taken up, and you are the example for many people. how many years we can learn more, and many whatever the age we can do and learn, do more. I mean, learning and doing. So there's such an example like Acharyas. Thank you so much. Dhanyavad.
Thank you, madam. I think I will continue with ISCM for DSC after this is over.
Yeah, Dr. Ananda,
Yes, sir.
There was a question on some cutoff on this, how much duration of practice. So you are thinking, because it has been already said that the duration will affect the
Daily for 15
result.
days, for 30.
How much should be attendance for cutoff? We keep attendance 80%, 60%. And beyond that, if it's a very poor attendance, then there's no effect there, minimum effect.
Yes, sir. Actually, those who have done not more than 15 days, doing for 3 days or 5 days or 10 days, those are the defaulters. Those who have done more than 15 days, but less than 3 months, that means doing for 1 month or 1.5 months or so, are called partial compliance people. And those who have done fully for 3 months are the total compliance people. I know that we have categorized them categorized and tried to analyze into the groups. But even the quantitatively also, 1 month group and 45 days group and 47 days group, the total duration, whether it is going to do anything, because the whole data analysis will be cumbersome. I did not do that one. I think I can do that one as I have got the data with me, sir.
So I think
Actually, we have seen, we have already published in 1 week duration effect is there.
yes,
We have published long back, isn't it?
yes, sir.
And it depends on. Suppose Ananda gives, even I can give, say, Shavasana, blood pressure falls on spot, same time. So, but it is a question of now when the asana is there, pranayama is there, long-term effect. Then how much should we say per week, say 5 days or say minimum 4 days or 5 days is adequate to maintain the desired effect. And then also when you stop practice, that is a long-term effect. When you stop practice, how much decompensation? What is the time course of that? That's a separate study.
I think we can make a clarity here, sir, that when we say that partial compliance and complete compliance and non-compliance, I think when we are mentioning it, we'll be more specific. Maybe we can put it in percentage, that 15 days, as you said, less than 15 days. What is the percentage as compared to the full compliance? And what do we mean by partial? I think we can specify it, sir. Yes.
No, that's a probably, I think last time I pointed out this point. That, and at least when you are doing large sample studies, a small sample should be studied more periodically, because whole sample is not possible. It's not possible.
Yes, sir. I agree with you, sir. Actually, one slide is there regarding the percentage of the people who are there in the full compliance and partial compliance. Because of the paucity of the time, I think I just skipped it within a fraction of a minute. And I know about your studies, sir. Doing just one single session of yoga, giving benefit in relieving from the hypertensive crisis and so on. So that's the reason why even the defaulters also get any benefit. I thought of doing that one, but as a whole, defaulters did not get any benefit. But when we analyze all those 155 people, those people who have done Savasana, those people who have done only for 4 days Savasana, they got benefit and they may be having higher score. So that particular specific individualistic analysis, I think we can do, because it is a thesis for this one. Instead of complicating the whole thing, I have restricted to this particular area. I think we can extend that one as we have got the database, sir.
Dr. Prasida, you had wanted to say something there in this?
Thank you for unmuting me. There was one related question I had, just so that this is clear to me. So you mentioned about defaulters, partial compliance, and full compliance group, and the duration also, like how many days. I also wanted to know, what did you expect as the frequency of the practices? So for people who are partial compliance, they have not completed 3 months. So what is the frequency that you expected? And also for the full compliance, full 3 months, they would do the practices, but then how many times in a week did you expect them to do?
We asked them to do daily 15 minutes each practice, and every week they were tried to contact our phone, and sometimes they could not be, and sometimes they could, and they said, okay, they are doing it. So every day for 15 days, that is the compliance. That is the expected compliance. But after the end of the 3 months, we verified whether they are really doing it or not. That is the thing which we have rated 5-star, 4-star, and all. They said 3 months we have done, sir. Okay, 3 months. All the 3 months, every day we have done. No. 10 days skipped because of some marriage. So they are considered to be the partial compliance people, and also they are rated as 4-star rated. So this is the way we have done, and it's not 5 days a week or so. Every day they are supposed to do. And surprisingly, some 3 or 4 people they felt so happy that they got addicted to this one and they wanted to do it thrice or so. Whether it is going to influence in any way something like a inverse you are not, I think we have to explore the things in future.
Thank you, sir.
I have a comment that there are some people on whom you can rely. Some people cheat also. They will say we have done all the 5 days, they have not done. I have seen one study where they found before they did actual study, they gave them a placebo and placebo only. One capsule contains some vitamin. That I don't remember exactly, some big complex. It is excreted in the urine. So they were given, and then there some time, and the urine was collected, and they found many people have mentioned that they were taking the drug regularly, but the urine it was absent. That color was not there. So they found that these people are not reliable. So you cannot rely on them, so they are excluded automatically. Now I don't know how you can do in yoga. That is there.
Yes, sir. Yes, sir. To identify the complaints, ideal is to get a video group activity every day. Those who attend the group activity only are really doing it, we can say. But unfortunately, somehow the group activity could not be done. When we asked them, no, the patient, because he's taking medicines, always he gets up at 8 o'clock only. Some people say that we do not have the smartphone enough to get the Zoom thing and all. So this type of things were there. But as you say that although they say they're offering complaints, see, even this particular thing also we discussed so many times in the journal club. For example, the diabetes status. When they approach the doctor, 4 days before coming to the doctor, they stop eating everything and they give a good picture as if they are getting benefited out of this thing. So similarly, they try to please the doctor, saying something or other positive. So this happens. I think in future, I think we can have some control, because my clientele are distributed around some 4 or 5 districts around. So that is the reason we cannot physically control them.
Yes, sir. So thank you very much. And I think it's a time to say thank you to everybody for being part of this colloquium today. A very special event, the first colloquium by a research scholar from ISCM in yoga therapy. And I would like to congratulate Rama Reddy sir on an excellent presentation.
This is first one.
First from ISCM, sir.
Very good.
And
so you should get prize. You should get prize.
We will, sir. We will. And I would like to thank Professor Madanmohan sir for being with us and offering his guidance and support always. Professor Panch Ramalingam sir, Professor Vijaya Gopal sir for being part of this, our own ISCM team here who put all of this together. And of course, Dr. Prasida Menon, Dr. Ingan, and so many others who have participated today. Thanking you all for being with us. We end with a prayer at this point. Sarve bhavantu sukhinah, sarve santu niramaya, sarve bhadrani pashyantu, ma kaschid dukkha bhag bhavet. Om Shanti Shanti Shanti. Om Shri Gurubhyo Namaha. Hari Om.
Sarve PhD students, Sapal ho.
Thank you, sir. Thank you, sir. Thank you so much, sir, for your blessings. Wishing you all to have a wonderful day. Thank you so much again. Dhanyavad. Nandri Vanakkam.